In this video, I'm going to show you how to maximize your patient outcomes by using a periodized exercise plan of care. I'm Dr. Joe Camerato, and I'm with Across The Continuum, and I'm here to make you a better strength coach as a physical therapist. There's nothing scary when it comes to periodization, but a lot of people get freaked out, including myself when I first started, when I hear this term. The exercise and strength and conditioning world is a big one, and it can be very nuanced, and it can seem like an elephant that we have to eat. Now today we're going to be talking about periodization. Now there are 4 variables that you're going to have to know to make an effectively periodized plan, and we're going to break it down as simple as possible. Periodization in and of itself is simply the planned manipulation of training variables. And without periodization, we're kind of just feeling around in the dark without a plan or without any structure to what it is that we're trying to accomplish. Now, when a patient comes in with a certain goal, and if that goal is a performance-based goal, we're going to need to make a step-by-step and structured plan or a skeleton to make sure that we can push and get to where they're hoping to go. You can imagine how rehab would go if we had no plan and we were just doing whatever we felt like during that day. And that's kind of what it's like to treat patients with an unstructured exercise program. We're just feeling around in the dark. Now, there are only 4 things that you need to know to create this structured program. Number 1 is going to be volume. Now, volume simply answers the question of how much. How much are we doing within this certain session or within this certain movement itself? And when it comes to the classic sense of volume, we have the sets times reps. Now, there's an inside joke in the physical therapy world where 3 sets of 10 is kind of what everybody gets, and those outside of the physical therapy world unfortunately also understand this inside joke. But that in and of itself is a volume prescription. We have 3 sets of 10, which is 30 repetitions overall, and that is the volume of that movement itself. We can also step outside of sets and reps and look at how much distance and how much duration. Both are also products of the volume category. And so if we wanted somebody to run maybe a half mile, that would be the amount or the volume or how much we want them to run. And in the same sense, if we ask them to run or swim maybe an hour, that would also be the volume prescription or the volume part of that training variable. So that's variable number 1. Variable number 2 is going to be frequency, and that answers the question of how often per time period. Now, the time periods are obviously going to change. Most commonly, we look at 1 week at a time. Now, if we say I'm going to do chest day twice a week, that is a frequency of 2 times per week based on that amount of time that we're looking at. We can also say that we're going to do legs maybe 365 times a year, which is also another amount of stuff that we're doing during a time period, but that also falls into the frequency category. Now, number 3 is going to be movement variation, and this is what we're applying all the other periodized bits and pieces to, what it is that we're doing in space physically. So this is choosing between a sumo deadlift or a conventional deadlift or a dumbbell bench press or a barbell bench press or what have you. Whatever we're applying the other variables of training to as far as the physical movements through space, that is going to be variable number 3, and that is movement variation. Now, finally, we have intensity. Now, I did another video on subjective intensity in the clinic, and so make sure to go ahead and watch that if you want a little bit more information on that. But intensity simply answers the question of how difficult or how close to failure we're getting in a certain context. And so there's 2 different types of intensity. We have subjective intensity and objective intensity. Now, subjective intensity is exactly what it sounds like. We're getting the opinion of the athlete or of the patient on how they're feeling during a movement exposure or during a bit of this periodized plan. We can ask them, how difficult do you feel like this is on maybe a 0 to 10 scale? And that would kind of fall into what's called the RPE, or the rate of perceived exertion field. We can also ask them, how close to failure do you feel? How many repetitions in reserve do you feel like you have? And that falls into that RIR, or repetitions in reserve, which is another way to measure RPE. We can also make it as simple as, is this easy, medium, or hard? And that can be a good way to apply the subjective intensity to people who might not be familiar with things like RPE or RIR. And the final 2 things when it comes to subjective intensity, we can ask them how this entire session felt. So did you feel like this whole session was difficult? As well as asking them the individual little bits and pieces of the session. And we can also ask them how fatigued that they're feeling, or a rate of fatigue, an ROF, which is basically asking how recovered do you feel, or how tired do you feel in this context, or do you feel prepared for this specific session or this specific movement? And we can also rate that on a 0 to 10 scale as well. Now, when we get into objective intensities, that's when things get a little bit more specific. We use objective intensities when we're looking at something like a repetition max. And so that's the line in the sand that we're gonna draw to say that, all right, I have done a 1 repetition max with back squat and I got up to 225 pounds, or I did a 5 repetition max with bench press and I got up to 185 pounds. But what we're doing is we're saying at this certain time, we're testing this certain movement and seeing what weight we can get with this certain amount of reps. And then we're using that test to proliferate or to fill in the periodization plan for the next few weeks or a few months in some cases. But objective intensities are a little bit tougher to use in the clinic because people are having symptoms, they're having pain, they are injured, they might be post-surgical. And so the repetition maxes that we set when people are having symptomatic presentations might not be super accurate as we go through time, because as we go through time, not only are they gonna get better, but they're gonna be able to perform more. And so that repetition max that we set prior is not exactly descriptive or conducive to dictating the periodization going forward. Now, if you're more into the functional fitness space or the CrossFit space, we can also use the objective measure of specific weights on the bar. Now, I can say for this Metcon or for this metabolic conditioning piece, we're gonna be using 95 pounds on the barbell, and that would be a specific and objective measurement of intensity. Now, just to recap the 4 training variables that you need to know to optimize the outcomes when it comes to writing a periodized plan of care are volume, frequency, movement variation, and then intensity. Now, if you can get those down and you can write a periodized program, then you are set and your patient is going to see the benefit of having this. Now, if you don't know where to start when it comes to writing a periodized program, we have a free guide that I will go ahead and link down in the description that will take you through all of this and more, and it will even give you examples of periodized programs to go ahead and give to yourself or even to your patients. Now, I promise you that if you apply this periodized plan or these periodized principles into your plan of care for your patients today or tomorrow or sometime soon, that they are going to see the benefit and you are going to see the benefit not only of their outcomes, but of their quality of life and their health overall. Now, if you found this video helpful, go ahead and share it with your coworkers or with your patients. Go ahead and comment below what you thought. And as always, go ahead and watch my other videos and let me know what you think.